Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How and where is Adcetris administered? Overview. Adcetris is given as an intravenous, infusion into your vein at a doctor's office or outpatient clinic. The infusion is usually given every 2 or every 3 weeks based on your diagnosis. Adcetris is a cancer treatment for different forms of lymphoma, blood cancer. Infusions take about 30 minutes to complete, but you may need to be at the clinic for several hours for preparation and monitoring. You may also receive other 4 medicines on the same day that may extend your time at the clinic. Your dose is determined by your doctor and based on your weight. Your doctor will also tell you how often you need to receive infusions, and how long you can expect to be at the clinic. Adcetris dosage information, in more detail. How long until I see results? Adcetris, brentuximab vedotin, is a medicine you typically receive long-term. It will start working right after you receive it, but you will not notice changes right away. Your results with Adcetris will depend on your specific diagnosis, stage of lymphoma, your medical status and how well you respond. Adcetris may not work for everyone. How long will I receive Adcetris? Adults in clinical studies received Adcetris for 6 months to 1 year. Your length of treatment may be shorter or longer based on your specific lymphoma diagnosis and regimen, results of treatment, or if you have side effects that require your doctor to delay or stop treatment. If Adcetris is controlling your lymphoma without serious side effects, you may continue treatment for as long as 16 cycles over 1 year. If your lymphoma stops responding or you develop side effects, you might need to delay or stop treatment earlier. For classical Hodgkin lymphoma, adults newly diagnosed with stage 3 or 4 classical Hodgkin lymphoma, (CHL), will receive an Adcetris infusion every 2 weeks with chemotherapy, doxorubicin, vinblastine, and dacarbazine, for up to 6 months, 12 treatments, until your disease progresses, worsens, or you have serious side effects. If you have relapsed Hodgkin lymphoma, you will receive an infusion every 3 weeks until your disease progresses or you have serious side effects. In studies, these patients received Adcetris for about 1 year. Relapsed means the lymphoma has returned after a period of time. If you have received a stem cell transplant, your treatment will begin 4 to 6 weeks later or when your doctor decides you are ready. After your stem cell transplant, you can receive Adcetris infusions at your doctor's office or clinic. The infusion is given every 3 weeks for up to 16 doses. You may receive fewer doses if your disease gets worse or if you have serious side effects. This typical course of Adcetris therapy takes about 1 year. Children. In children 2 years of age and older with previously untreated high-risk classical Hodgkin lymphoma, (CHL), Adcetris treatment is given in combination with chemotherapy, doxorubicin, vinblastine, etoposide, prednisone, cyclophosphamide, every 3 weeks for a maximum of 5 doses. Related questions: Is Adcetris a chemotherapy drug? Prednisone, what are 12 things you should know? What is the success rate of Keytruda for certain T-cell lymphomas? Adults newly diagnosed with peripheral T-cell lymphoma, PTCL, will receive Adcetris as an intravenous, infusion every 3 weeks for 6 to 8 treatments, over a period of 18 to 24 weeks. You will also receive chemotherapy, cyclophosphamide, doxorubicin, and prednisone. If you have relapsed systemic anaplastic large cell lymphoma, you will receive an intravenous, infusion of Adcetris every 3 weeks until your cancer gets worse or you have serious side effects. In studies, patients were on treatment for an average of 7 cycles. If you have relapsed primary cutaneous anaplastic large cell lymphoma or CD30 expressing mycosis fungoides, you will receive an intravenous, infusion of Adcetris every 3 weeks for up to 16 doses maximum, 48 weeks, or until your cancer gets worse or you have serious side effects. Serious side effects with Adcetris. Serious side effects may be life-threatening or lead to death. Call your doctor right away if you have any serious side effects, which may include PML, a rare, serious, viral brain infection called progressive multifocal leukoencephalopathy, PML, that can lead to death, may cause problems with speech, thought, vision, or muscle movement, liver, stomach or lung toxicity. Allergies, serious allergic reactions, hives, difficult breathing, swelling in your face or throat, harm to an unborn baby. Skin reactions, a severe skin reaction, fever, sore throat, burning in your eyes, skin pain, red or purple skin rash that spreads and causes blistering and peeling, high blood sugar levels. Nerve damage, peripheral neuropathy, may cause numbness, weakness, burning pain, tingly feeling, or loss of feeling in your arms or legs. Tumor lysis. Increased infection risk, a low number of white blood cells, neutropenia, that can increase your risk for infections, fever, chills, tiredness, mouth sores, skin sores, easy bruising, unusual bleeding, pale skin, cold hands and feet, feeling lightheaded or short of breath. Low blood cell counts. See more information about side effects by reviewing the Adcetris patient information. This is not all the information you need to know about Adcetris, brentuximab vedotin, for safe and effective use and does not take the place of talking to your doctor about your treatment. Review the full Adcetris information and discuss any questions you have with your doctor or other healthcare provider, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.